Assalamu alaikum. Hello, everyone. This is Dr. Muneeb Uddin Karim, our radiation oncologist from Pakistan. So we have a famous radiation oncologist, Dr. Mushabbab Asiri, with us. We would like to ask a few questions from him. So, Dr. Mushabbab, please, first of all, introduce yourself.
Thank you very much. I'm very pleased to be with you, Mujib. My name is Mushabbab Asiri. I'm a radiation oncologist from Saudi Arabia. I trained in Ireland, St. Luke, so I am with some of the colleagues. We trained together a long time ago, maybe 30 years ago, in Ireland. I'm working as director of Saudi National Cancer Center. And at the same time, I'm the CEO of the Saudi Proton Center in Riyadh.
Okay, thank you for your brief and nice introduction. So I have two questions for you. So today was basically is the first day of the AMSTRO and the first conference of this society. So what do you think about this society, and how was your experience today?
Excellent. I think this is a very smart and clever move to get the radiation oncologists from all over the area getting together and to communicate their experience, to share their knowledge, and to see how we could improve and develop the services in our countries. Radiation oncology is dependent so much on the technology and availability of resources, whether it is financial or as in human capital. And the radiation oncology services in the region are different. Some countries, they have an excellent services, and others they have maybe modest and other undeveloped. Maybe some areas that they don't have any radiation oncology services. So I think by getting together, we're able to know the pain points in the region and where we could put our hands together to help in improving the service or to establish service. I understood today from the speakers some countries there is no radiation oncology services at all, like in Africa.
Yes.
If you look to countries like Pakistan or to Emirates or Saudis, I think there is to some extent available resources with enough human capital, but there's a lot of countries they don't have the infrastructure for radiation oncology, and I think by getting together in these meetings, we'll be able to either to identify where is the problem, probably be advocates for the people to get the services, and also today I noticed that there is international presence in this meeting from Europe, from UICC, from ASTRO, from AMSTRO, and I think those will be able to help us to at least to establish the services in a country where it's not available.
Thank you for the discussion, and just to emphasize this point, that from the platform of this society, you think that this can bring a positive change and impact in the whole region?
I think so, but we should not be in a hurry. I noticed the improvement in our field take decades. If we're looking for low-hanging fruit, it's not there. I think we have to suffer, we have to be patient, and it will take time till you see the improvement. I remember when I started my career back in Saudi, and I came back around year 2000, and the service is only in 2 hospitals in the country, and the radiation oncologists there are only 10. And it was developed over 20 years. Now we have more than maybe 15 or 20 centers, and there's more than 66 consultants in radiation oncology. And the same trend will happen in all other countries. We have to take the time to identify the problems and also to come and develop it. You know that for radiation oncology, you should have some training in medical physics and radiotherapy, in technology and engineering. All those together will build the radiation services. Also, you have to build the capacity in the medical field. Nowadays, there is residency programs in some countries that I know there's in Pakistan, there's in Saudi. I think we'll be able to train others if they identify themselves. And also medical physics training now, it became a necessity in the area to improve the technology. Also, we have to be advocate for the people. Radiation therapy is not cheap services. It's very costly. And then we have to be advocate for the people to get the right fund from the government and to allocate some budget for radiotherapy. A lot of budget goes for medication, chemotherapy and others. And I think this is not wrong, but also I think they should allocate some budget for radiation therapy.
Thank you very much, Dr. Mushabbab. And that's all from us. And we were talking about the AMSTRO. We were talking about the AMSTRO's impact from this conference. So thank you very much.
Thank you.
Thank you.
يعطيك العافية.